Hello, and welcome to Conversations with Faith Leaders on Health. This series looks to be a tool specifically for the faith community who are interested in developing or sustaining a health ministry. I am your facilitator, Reverend Krista Forbes, and this series is hosted by Our Health Ministry and was developed in partnership with Morehouse School of Medicine's National COVID-19 Resiliency Network. Our health ministry is where faith, health, technology, and community intersect to provide trusted information, tools, and connections that support faith-based organizations. I will look to have a variety of conversations with members of the faith community about their interests and/or involvement in health ministries. And today I will be joined in conversation with Barbara Baylor. Barbara Baylor is a public health consultant with over 32 years of public health experience on all of the local, state, national, and international levels. And she is currently one of the project consultants for SEAL, which is the Community Engagement Alliance Against COVID-19 Disparities Project, which is one of the cities is in Atlanta, Georgia, where she concentrates on building effective alliances with the community and developing a response to COVID. Well, hello, Ms. Baylor. How are you today?
Hello, Reverend. I was going to say Reverend, but may I call you Krista?
Please call me Krista if you don't mind. I'll call you Barbara. We'll keep it real comfortable today. Yes.
Okay. Hello, Krista, and thank you. Thank you so much for the honor of being in having this conversation with you today to share some of my thoughts on the importance of realizing that the role that churches can play in health ministries. I appreciate that. And before we get started, I do want to say, that the SEAL project is a project that was funded by NIH through given to Emory, Rollins School of Public Health, and Morehouse School of Medicine. I want to say that, give them a shout out. And I would be remiss if I didn't say that I am a graduate of the Gillings School of Global Public Health at the University of North Carolina in Chapel Hill.
Oh, wonderful. You got to get your plug in for public health. Yeah.
Right.
Well, I appreciate that. And definitely looking forward to this conversation because you bring such a wealth of public health knowledge and experience. And then also your workings over the years with the faith community. So I want to jump right in and ask you, when you have worked and even thinking about other opportunities of working with faith organizations, what resources should be explored when starting or sustaining a health ministry?
Great question, Krista. And I want to start out by saying that I believe that health ministries ought to be viewed as a central part of a church's overall mission. I want to start by saying that. And I had the wonderful opportunity of working in one of the very first lay health advisor programs and models in the state of North Carolina through the General Baptist State Convention's Health and Human Services program. Mm-hmm. And it was a lay advisor project that helped train lay leaders to become health ministers in the state. And it was, again, partnering with the University of North Carolina at Chapel Hill in the 1980s. And this program pioneered church-based health education in the rural areas of North Carolina. And over 300 lay leaders were trained in this project to help provide health information, health education, identifying congressional needs, making referrals in the community, resources, and providing screenings, and they offer general support. But the one thing that I want to say that was important about the reason I'm mentioning this, why this is important, is the program and the training were grounded in the words of Dr. Eva Salber, who was at Duke University at the time. She was a noted medical doctor and public health professional from South Africa.
Oh.
And she used to say that in every community and in every church, there are people to whom others turn naturally for advice, help, and support.
Mhm.
And she pointed out that health ministries are designed to enhance a participants' natural helping abilities and to enhance their role of helping and advising others. And added to that, there was a research study that was done that found that people seek health advice from those who most look like them and not from a health professional at first. And so these sage words I want to share with you today guided the work in planning and implementing health ministry programs. And that when you're thinking about developing health ministry programs that are going to strengthen that social support function that your church is probably already doing. So I wanted to say that. And so when you think about resources in your health ministry, who should be involved? What kind of resources do you need and do you need? And you think about resources, not only just being the funding, but the people themselves, the materials, their time, et cetera, et cetera. And so I think it's important to include assets as resources. And first looking within the church for assets such as the gifts and talents and skills that could be utilized in a health ministry from the people that are right there in your congregation. And secondly, look to the outside in the surrounding community for those same gifts and talents and skills. And then thirdly, looking to agencies and organizations, which you kind of already know the kinds of things that they can provide for your health ministry. So you do not necessarily go to one source because everyone has a stake in making sure that the community is healthy. And one of the things that I like to say on this point about assets and resources is that there is evidence. I've said this before many times. There is evidence in the community, and what I mean when I say that is we know that health professionals working in the community, we understand evidence-based programs, right, Krista?
Mhm.
And those that are proven to work through experimental and research studies. But what I like to say is that the community utilizes evidence-based practices. And although we don't call it that, in the past has helped us through all kinds of health and emotional needs. And these are the skills and the practices, recipes for life, the wisdom of the elders, our church mothers, our non-formal nurses. Those are the units. My church had a nursing unit. Not everybody was a trained nurse, but nursing units that have all been effective and worked for members of faith communities and communities for a long time. So health ministries can be useful here in bridging that partnership and those gaps that I'm talking about between what research calls evidence-based and the natural evidence of the community. So when you think about resources, I kind of look at it like that, Krista. And it's also important to, when you think about resources and the infrastructure, in some of our rural churches, like the project that I worked on with the General Baptist State Convention, there were limited resources because it was a rural area. And so developing health ministry teams in rural churches may help build the infrastructure of that church to really equip them and to help them to reach out into the community and handle some of those pressing problems that the community has. And if your church is already established as a health ministry, and what I mean by that is a trained health ministry who has already been given the blessing of the pastor and the church administrators to have a health ministry incorporated in the church, it may be possible for you to then petition the church and administrative officers to include a small line budget that will allow the ministry to purchase some of the materials that it may need. Now, if the ministry is already sustained, the church may ask you to provide a report or an accounting of what have you done, what have you accomplished as a health ministry in the church. So you want to explore national, local funding, regional in your denominational offices, local grants, grant foundations such as the Kellogg Foundation, who are always looking for faith communities to partner. They have a lot of money that they give out. I'll stop right there.
No, that is wonderful. You know, I wanted you to just keep going because you raised such a great point about, you know, we hear these big terms about evidence-based research, right? And it can throw people, but if someone is in a ministry, even in, you know, a lay person in a church, and they don't have the science or research background, they can still be able to connect with what they are already doing and the resources they already have to go after those grants, to go after those big dollars that do exist. But it may, you know, we sometimes get afraid and don't pursue them because of the big words, right? And we're right there. Our churches are already equipped with that. So thank you.
And they're right. You're exactly right. They're already doing that. So that's why you reach out and find who's doing what, but then reach further into partnering with organizations that have those kind of skills and have the time, because one of the barriers to health ministries a lot of time keeping it going is time, the time factor, and people always don't have the time to work on things.
Yeah, and partnerships are very key in that. Well, I want to thank you for that question, but I also, you know, I can't let a public health professional get out of here without asking one specific question. You know, as I think back to the past couple of years, and surely everyone watching this can relate, you know, to the COVID pandemic and all that we experienced there. And during that time, we heard and a lot of awareness was raised about public health. Right. I think sometimes for us as public health professionals, we've always known it was called public health, but it was kind of something new for a lot of people, but people were able to learn and be introduced to what it actually is. And public health includes not just disease and research, but it definitely highlights the disparities in the healthcare system, racism, and other social factors that all of that comes together impacting one's health. So given the lens of public health and given what we have come to know, what conversations could faith leaders have within their own communities to promote health in general? And what would you like to, how would you answer something like that for our faith leaders?
Well, two things come to my mind right now, Krista, immediately about that is one major conversation that I think it behooves us all to have, and faith leaders and community leaders as well, is the continuing shrinking of healthcare dollars in our communities and across our state, that it's threatening the healthcare access to important services, and we have to think about how we might think creatively on ways to promote health equity. Now, one of the things that's happening where I live here in Atlanta is that one of the hospitals is closing, and it's the only hospital in the southern region where I live. And so there's been a lot of discussion and a lot of talking about that. And you know, hospitals, it's happening all over. The clinics are closing, different services are closing, and they're moving way out, and people have to spend, so you're talking about transportation, gas, your cars, time off of work, all those kinds of things. And so and they're moving out of the communities. So we have to think about how creatively how we can come together as a community. That's one big conversation. And again, this is makes the case for why faith community is an integral part and can play an integral role with public health partners, public health, other health and human services organizations to address these kinds of challenges and issues. Again, I'm a big proponent of forming these multifactorial collaboration groups, and not just with health, but you need education, you need transportation, you need the finances, you need all of these groups to form these kind of collaborations to look at where the interconnectedness lies to work on, a lot of these poverty and socioeconomic justice issues and conditions. Now, when the faith community reflects on some of the challenges and these injustices, disparities, inequities, and inequalities, the current COVID-19, as you know, Krista, has re-exposed all of those historic issues that from the past that sometimes we think, oh, it's getting a lot better, but then something happens and you see they rear its head again. Mm-hmm. And so this is what's happening in COVID, the job loss, the diminished access to healthcare, the skyrocketing rents, the housing market, oh my goodness, and those who have been evicted due to lack of income and can't pay their rent. This dismantling of voting privileges, as you're seeing now. And food insecurity is a big one that a lot of our faith communities have had to step up to do the food insecurities, and also mental health, looking at what's happening in our mental health system, the violence against people of color, the continued racism, discrimination. So when we reflect on the historic faith involvement in these social justice and civil rights issues, one way that I believe that the faith community can approach addressing these disparities and inequities is, again, by addressing these, by using a faith lens and a faith vision and having a faith voice. Now, an example of that is during the healthcare debates, the United Church of Christ, along with many other denominations and interfaith organizations, were a part of a large coalition called Faithful Reform in Healthcare. Okay. And what we found, what was missing was both a vision for what we really wanted to do and how faith communities could really be a part in providing that vision. So we worked collaboratively a lot during that whole healthcare debate. And through national multi-faith, interfaith dialogues, we developed a vision statement that used faith language. And we carried that vision and statement, Krista, all the way to Congress, where we were able to we were invited actually to meet with Nancy Pelosi and Chuck Schumer. And we were able to change some of the thinking about the need for healthcare system that works for everyone. That really wasn't a vision at the time, that we need something to work for everyone. So today, there is still a need for this same kind of multi-sector collaboration and developing collective vision statements and plans for collective action and collective faith in faith conversations. And so it's utilizing and incorporating faith lens, faith language, and a faith vision can help health ministries in their approaches to identify what some of these public policy issues are of importance to their community, and they're within their congregation. So then you'll be able to mobilize a congregation for action. You can advocate on what of these critical health and social justice issues and begin to increase community capacity through that same very training and education on a lot of these health and healthcare issues. And what I want to say about that is people say, well, we don't have young people in our congregation, or we don't have. Someone mentioned to me one time, we don't have a lot of people of color in our communities, so we can't really work on these kind of issues. But what I want to say to that is that faith leaders in your conversations and in your thinking about how you want to approach health and health equity, but to use that as a framework and a lens through what your congregation can do individually. What can your congregation do and work on any justice issue that it chooses? So we're not saying, well, you have to work on everything, but choose what it is in your community that you see as a priority, and begin to look at who you need to coalesce with, what networks do you need to build in order to maybe just work on that issue. It might be just food security, Krista, or it could be the transportation is too many. It could be lights in your community, which is a justice issue that we oftentimes don't think about that. So that's just the one conversation. Then the other conversation that I think is important is advocacy. I know I'm talking a lot, but advocacy. Faith communities obviously cannot endorse political candidates or mobilize supporters to elect a candidate, but or even align with political parties. But what faith communities can do is to engage in direct advocacy. And that is simply expressing their positions on legislation related to the common good. What is some of the legislation related to the common good in your community? And you can engage in grassroots advocacy and lobbying. I know that, again, that lobbying word sounds like, ooh, but it's, basically advocacy where you're engaging with the public to really help them understand what the issues are. Things like speaking up for Medicaid expansion, right. Or speaking up about the Family Medical Leave Act, or just speaking up for more dollars, again, back to that shrinking healthcare dollars, putting more dollars into our states for healthcare. So conversations like these help address some of these injustices, these disparities, and the inequities that you had asked about before. And what is the role that advocacy can play? And all of these things are part of what a health ministry can do. So and even that, Krista, the advocacy is rooted and grounded in our faith teachings. Many of us, when we think about I'm paraphrasing the scripture, Proverbs 31:8-9, it says, speak up on behalf of those who cannot speak for themselves. And then we also have other sayings that we use in the faith community. Speak truth to power. How many times have you heard that? Speak truth to power. And religion has espoused that saying, and it's been used for years. And it was actually said first by Baylor in 1942. He said that. So when you think about this conversation, those are just two. There's many, many, many more. But talking about the shrinking healthcare dollars and how do we coalesce in the community and, again, build these collaborations to address some of the things. And then how do we explain to people why this is important? And then looking at the advocacy piece. I think that having a health ministry to do that can help the communities and their local and state entities to view these kinds of situations and solutions through a moral lens, Krista, through a moral lens, which is also evident and grounded in our faith traditions.
Excellent. That was a lot, but it was so great because I think, and hopefully someone listening to this, we think about just one dimension of health ministry, but you have certainly laid out some wonderful nuggets that people can look at health ministry a little differently. It's not just the health fair, but maybe, and you don't have, the means to do a health fair, but everyone has the means to be an advocate for the hospital closing in their community, for the drugstore not being available in their community, and those types of things. So I want to thank you so much. We don't want to go because we could definitely, there's so many issues and conversations, we could definitely continue, but I want to thank you again, Barbara, for your time, for your great insight and your wonderful wealth of knowledge and history of how public health has always kind of been there and with working with the faith community. So again, thank you so much for joining us in our conversation today.
Thank you.
No worries, anytime. We'll have to definitely bring you back for a part 2. And I want to encourage you, as well as others who might be viewing this, that if they're interested in learning more about developing or sustaining a health ministry, that encourage them to visit our health ministry, the website at www.our all one word.com. And again, we want to thank not only Barbara Baylor for joining us and our health ministry for promoting this, but we want to thank again to Morehouse School of Medicine's National COVID-19 Resiliency Network for allowing these conversations to take place. So again, thank you so much for participating in our conversation. And until next time, we ask and encourage everyone to be of great health. Thank you and have a great day.
Thank you, Krista. I appreciate you're asking me. Thank you.